Namaskar everyone, welcome to Endeavour. This is the doctor's seminar session for our MRTP students so that they can gain some knowledge about what a doctor wants. So let's start.
Yeah. Good evening, everybody. Dr. Abhijit Roy, he has joined. Okay. So Dr. Abhijit Roy is a renowned doctor. He is an MBBS, DGM, DDM of renowned hospitals and nursing home. And he also is a visiting faculty in institution and nursing home. Okay. He's here around 15 to 20 minutes to share his valuable time. So whatever queries you have, you would be asking after the session is over. Okay. So I would hand over the session to Dr. Abhijit Roy. Yeah, welcome, Dr. Abhijit Roy.
Sound audible?
Yes, doctor.
Thank you. So today's discussion is about the present scenario in today's practice and today's day-to-day life. As everybody know that COVID has been here for around last 2 years. So it has some recent modifications like Omicron variant. In between the time, it has also Delta variant and other Delta plus variants. These genetic mutations will recur definitely, and it will definitely happen in our future also. COVID will be a part of our life for many years to go. So, as there are many speculations about Omicron variant that it will be more infectious and it will definitely have a disastrous results. But these all are speculations. We don't know yet what will happen in future, as we never estimated that Delta and Delta plus variants will do such havoc in our life. But recent studies and all the papers published by South African government and South African faculties, it shows that Omicron variant has lesser chance of severe infection. It has definitely has a much more chance of infectious disease. Infectivity will be much higher, but the severity of the disease will be less. So all the important parameters like proper usage of masks, social distancing will be the key factor to prevent Omicron. Definitely, we all are vaccinated at present moment. Most people are. Some people are partially vaccinated, and many people are completely vaccinated. So the chances of severe infections will be much lesser in Omicron variant. So we have to understand that we can stay home forever. For many years to go, we can stay home. It's not like that. So we have to definitely go out to work, to other things. But these basic three parameters, that is social distancing and masks and these and hand wash, these things are part of our life, and it will remaining with a part of our life for longer duration. So that is the basic thing that I have to tell all the people here. Now you can go for the question answer session. But that I think that will be beneficial for the students here, so they can give me any queries, and so I can give their queries.
All right, students, thank you very much for the speech, doctor. This is Sandeep Raivalia from Endeavour. Students, now this session will be open for you. Dr. Abhijit Roy is here. He is here to help our MRTP students
Once you become medical representative, you will be visiting different doctors. He is the best person to give you guidance on what are the likings and disliking of the doctors. So if you have any question, you may ask your questions one by one. All right, to start with, doctor, I would like to ask you a question on everybody's behalf. Can you please tell us, why would a doctor write a brand? If a medical representative visits a doctor, basically, the same molecule is available in different brands. So why would a doctor prescribe a single product? What is the reason behind it?
See, as we all know that every composition has multiple brand names. As a doctor, I personally always prefer a bigger brand. You have to understand that the brand value has something to do. As we went to anywhere, I went for shopping, we always try to find some brands. It may be Indian brand, it may be well-known multinational company, it can be anything, but it must have some reputations. The company must have some reputations before I should write a brand. So that is one of the most important factor. That is the brand value of the product. Definitely much more important than anything. Secondly, another factor is, as we all know that we practice in such a place where many person cannot afford high value medicines, because the socio-economic status is not quite well off for many persons. We don't live in states like US or UK where the government provides all the medicines to the patients as it is government's responsibility. But here, most people buy their medicines from their own pocket. So pocket friendliness is also an important factor. Third part, definitely, medical representative behavior is an important factor here. As we all know, if you look well, if your looks are quite good, then the products will also definitely sell. वही बांग्ला ते हमरा सब समय बोले था कि हिंदी में भी बोल सकता है कि पहले दर्शनधारी फिर गुण विचारी, ये तो हमारा बेसिक things है. So looks is an important factor. So these are the basic things for which we write a brand. Definitely.
Okay. Thank you very much for the information. I hope it will help the students to understand why a doctor would recommend a brand. Doctor, we would want to know, often you have seen there are experienced medical representatives visiting your chamber, and there are fresh medical representatives as well. By your experience, you are able to understand who is fresh and who is experienced. So what do you expect from a fresh medical representative? If he is a new guy, what do you expect from him?
One thing is most important thing. I know that fresh medical representative must not have many knowledge. So he is new in the field. He or she must have some reservations before entering to any chamber. But you have to be smart. That is the most important thing. You have to be smart. Looks definitely important, but smartness is most important thing that we always prefer. When in our life, we also say that when I have started practicing, the basic thing in the first, the books we have read all the things, but its implications to what to write, what not to write, it requires an experience. And in medical representative case, it's also same. What to say, what not to say. And that is the most important. You will learn accordingly with your experience, definitely. But smartness is the most important thing. You must have that. That is the most important thing in your freshers.
So delivery plays a very important role. How smartly you can deliver in front of the doctor.
Right? That's the most important factor.
Right. Doctor, one thing, attached to it. one more question would be there. But we have seen that medical representatives do have a lot of products with them, but when they visit you, do you like them to, read out detail all the products to you one by one, or how many products you would like to, get the detailing of at a max in one visit?
See, most doctors take visits of a medical representative after their chamber, mostly. So the point here is, a doctor is a simple person. If a doctor done his chamber for his around 2 to 3 hours, after that he takes a visit for around 15 to 30 minutes. So it's not possible for any doctor to hear all the things patiently. It's very difficult for us to hear all the things patiently. So you have to categorize your brands and your products and what you want to promote with greater percentage. You have to understand that, and accordingly you can give a description about one or two brands, but not more than that. It will be very difficult. Then the doctor will not listen to you. You will be staying there, you will be listening, but it will not be registering in his mind.
Right. You got it really right. Doctor, what is the one disliking about the medical representative that you see? Basically you have likings and dislikings about the representative as well,
Definitely.
because they are a part of your daily life. So what is that
Definitely.
one thing that you dislike about medical representative?
As I said, I like smartness, but definitely dislike over smartness. That is the most important thing. Many have much problems that many can properly cooperate with each other. Many cannot say properly what they want to say, but that happens to everybody's life. But you should not be over smart. That is the most important thing. You don't take anything for granted. Okay? If I I talk to you in friendly manner, you should not take that advantage to your phone. That is the most important thing. You have to be smart, but don't become over smart.
Right. So, doctor, attached to this, one more question: has there been an instance in your life? You are practicing from such a long time, 10, 15, 20 years. Has there been a time in your life wherein you have prescribed one product, any one product in a single visit of a medical representative? Has there been an instance?
See, when you started doing practice, yeah, there are many products that with any representative doesn't come to me and I write prescriptions, because I was prescribing that from my childhood medical college days. So that are the points that where you can prescribe anything uh, without visiting, without with a visit of a medical representative. And definitely that happens, but there are some brands, there are some unknown brands, there are some very less used brands that we always forget during our day-to-day practice. When you remember that things, these are the specific brands, these are not used regularly. When medical representative describes about that, we always remember our books, that it was written in the book, so we can try that. This had happened many times, that I have written up a brand in the first visit of a medical representative. Definitely.
Right. So, doctor, if you have written, say for example, you have written a brand which was not available in the market, right? The prescription bounced. So how do you feel when prescription bounces? Do you
I
like
don't
to write?
completely dislike it. I absolutely 100% dislike it, because in my personal practice, as patient load is quite high, so I always receive around 100 to 120 calls a day. So the point is, if one more calls come from a chemist, it is disastrous for me practically.
So basically, if a prescription bounces, what can be done to convince you that it will not bounce again?
It's very difficult for me to convince you that these things. Like, you have to make sure first that the product is available. Then you have to promote this product.
Right. So this is difficult thing. So doctor, you are practicing from such a long time, and these young medical representatives who are being trained at Endeavour, you have seen them in the market. Previously, has there been any other institution that visited you with this kind of students who are going to get the training of a medical representative by visiting chemists and doctors? So this is an initiative that was taken by Endeavour for the first time. How would you rate it? Your likings, your view on this?
No, I must say that it's a very good thing to do, because they must have some real life experience, real life teaching to do what to do in future. As we all know, in medical profession, there's two things called internship and a house staffship. Everybody knows that interns and house staffs. These are the things you know by hands-on training. You must have some hands-on training to become a doctor. And so in everything, I think to know a thing better, you must have some hands-on training. That is the most important you are doing, I think.
Right. Thank you very much for that, doctor. Doctor, currently, I'll open up the question and answer session for the students. I hope they must be having few questions, and thank you very much for giving us so much time. Doctor, one last question from my side, then students might ask few questions to you. Where do you sit? Because this will be also available on YouTube. So it is very important. Our motto of this Hello Doctor project is also to make the doctors available, information available in the market, so that the patients can get benefited. So can you please tell us where do you sit and what are your, chamber timings?
My chamber currently at Shushusha Clinic, Kampurgachi, near Pantaloons. My timings are from 11 to 1 in the morning every day, except Sunday, and in the evening 5 to 6, same place. That is the chamber, and you can have the number of my bookings. So for the bookings, I think.
All right, sir. We'll have the number of the booking and we'll display it in the screen so that any patient who is looking to visit you can get in touch with you, and get benefited with your services. Apart from that, doctor, can you please let us know? Can you please give one message to this young medical representative, young trainees that you would want to give?
As I said earlier also, that smartness is an important factor. You have to be smart. Smartness can be achieved by training. Everybody doesn't born with smartness. It can be achieved by proper training. So become smart, don't become over smart. Learn the things you are saying and learn the products. The important thing is that if you are promoting some products, you must have some basic knowledge about the product. You must not have extensive knowledge about the product, but must have some definitely basic knowledge about the product, that if anybody asks any question, you must aware that what you are selling. That's important.
Right. Thank you very much for sharing your valuable, views on overall questionnaire, doctor. Now I'll open the forum to the students. Students, Dr. Abhijit is available for all of you today. First of all, from on behalf of all of you, we would like to thank him for this wonderful initiative of giving time for the youngsters. Now the questionnaire session is open for you. If you have any question, please you can ask. Anyone?
Hello, sir. Hello, sir. I'm
Yes,
Shubhajit Datta.
All right.
Sir, I'm audible to you?
Yes, you are audible, Shubhajit. Please ask your question. Others, please mute yourself. Others,
when we talking about the...
Yeah, Shubhajit, please continue. Shubhajit, please ask your question.
Sir, I think his mic is not audible. Sir, can I Can I talk a question, sir? Hello,
Please,
sir.
please start.
Hello, sir.
You can say.
Hello, sir. My name is Orijit, and I have a question. So, if a medical representative could not convince a doctor because of his low-value branded medicine, so what would be the next step for that medical representative to be successful?
See, one thing is very important, that if you see one thing at regular interval, and if you are sincere to your work, it is the most convincing factor for a doctor. You have to be sincere. As we also say that value is an important factor. We always don't write high value products. We must use
Yes,
low value products for patients of lower socioeconomic group. So everybody has some different prescriptions or something. But the important thing,
yes, sir.
your sincerity will definitely speak for you, and it will reflect in prescription in future.
Okay.
All right. Thank you very much,
Thank you, sir.
for
Thank you,
answering this
sir.
question. Next question.
So I would like to ask a question. I'm Abhishek Bhattacharya. Sir, am I audible, sir?
Yes, Abhishek,
Yes.
please continue.
Yes, sir. I would like to know your pain habits, sir. The some medicines you like to write. I would like to know that.
Definitely,
The ones you prefer.
the pain habits are habits that will definitely happen to every doctor. If I, as you know, that a common brand called Lasix, it's been written for years and years and years and years. But there are some other brands also in the same category and same year. But we write Lasix. Okay. Because of our pain habit, we used it from our day one of the practice, day one of the study, to till now. Similarly, other drugs are there, like if you don't remember anything, you write PAN 40. You know that you are using it from the very first day of your practice and very first day of your classes also, in hand-on training classes also. So it's like some brands used to be in your pen habit for longer than anything. That is the most important thing. In your career, you will definitely see if that a doctor wants to write your product, but cannot write because of his or her pain habit. But it, as I also said, that your sincerity will be reflected in your prescriptions. So it will definitely change. It can change. It changes for me also, for some drugs also, because of regular perseverance of the representatives. So it happens. Pain habit is a difficult to overcome, but it will definitely occur and it will definitely changes.
Yes, sir. Thank you, sir.
Hello, sir. Myself Shundeep Manna. Can I hearable?
Yes, you're audible.
I have a question that suppose I visit a doctor a couple of times or many times, but doctor doesn't prescribe my medicine. What can I do? But my behavior is very polite, and my molecules and the price of my medicine is very cheap. But doctor doesn't return it. What can I do that time?
That's a difficult thing, but that's the point. You have to wait, because you are not visiting a single doctor. You are visiting a multiple doctor. So from here and there, you are getting some prescriptions. So you have to wait. As I also said, your sincerity is an important factor. You will wait. Definitely, the time will change, and his or her, as I also said, that prescription pain habit is a difficult thing to overcome for a doctor also, because every doctor stays in a high risk zone. It's always a difficult situation outside. It has multiple tension, multiple tension situations they are undergoing. They cannot write anything and everything definitely. So sometimes pain habit become very difficult to overcome. So waiting is the only way to overcome this issue, I think.
Okay. Thank you, sir. Thank you so much.
Okay, students.
Sir, my name is
Before we start, the next 5 minutes only, because as I am aware, sir has other works as well. He has to visit other hospital PLS for some important work. So we have only, sir, can you please give us 5 more minutes, then we close?
Okay.
All right, so 5 more minutes, only 3 more questions. After that, again, we'll be having session. And if you guys have any other question, you can note it down. You can give it to me. I'll get answers from sir to you directly. All right. So yeah, next
Sir,
question.
Sir, my name is Prabhudash. Am I audible?
Yes, Prabhu.
Yes, you are audible.
Sir, my question is that if a medical representative at the first visit fails to promote his product for some reasons, and what steps should he take for the second visit so that he doesn't fail to promote his product for the second time with the same doctor?
I don't think that it will be a problem. Practically, many times we cannot promote many brands because of our communication habits, communication difficulties, or something like that. And doctor was busy. That can be a problem. So I don't think it will be a problem. That I think your time will come. You will definitely have another chance to promote. So always become confident and promote your product.
Thank you, sir.
All right, next question. Next question, guys, a little faster.
Hello, sir.
Hello.
Yeah.
So
I was lost due to some technical problems.
All right, Dibyaduti, you are having some
Question is-
technical problem. You are not audible. Anyone else?
Shubhajit here.
Shubhajit, please ask.
Sir, my question is, when we talk about medical representative, we often talk through like punctual, dedication, presentable, work.
I guess there is some technical issue. Sir, can you hear the question?
No, I cannot hear it properly.
So Shubhajit, there is some technical issues. We are running short of time. This is time to release for today. Sir, guys, if you have any other question that you want to be answered by sir, please note it down and please give it to us in your respective batches so that we can get the answer for your questions. We'll be having doctor session once again with proper timing. So stay connected for that session. Sir, I would thank you very much for giving the time to the youngsters and conducting this wonderful session.
So thank you very much everyone for viewing this video. I hope this video has been informative and it will help you in your daily life as a pharma professional. If you have any suggestions, please write it down. We'll try to bring more informative videos for our MRTP students, and for inquiries for MRTP admission, numbers are there. Thank you. Take care. Bye-bye.